So the fibula flap, probably the most commonly used bone flap for reconstruction. Important landmarks, you can palpate the fibula bone, head of the fibula, lateral malleolus, posterior border of the bone. Skin paddle should be posterior to the posterior border of the bone, although you want to really Doppler the skin paddle and see where the perforators are and make sure that your skin design encompasses this. So we'll go ahead and make the anterior incision first. Important thing to keep in mind here is we'll need to see the perineal nerve as it turns around the neck of the fibula to preserve it. We want to take our bone as high as we can here to give us access to our perineal blood supply. So this will be over the anterior compartment muscles. We'll go ahead and open the fascia over the anterior compartment. So as we make our anterior incision, these are anterior compartment muscles. We want to push that away and see where our perforator is to our skin panel. As we open up here, we see a nice perforator right here in the lateral septum. There's one large perforator here, one smaller perforator here, and that's it. So next thing we're going to do is we're going to dissect proximally and look for our nerve. The perineal nerve, as it comes around the neck of the fibula, is often hidden in some fatty tissue here, which we see here. And this is going to limit where we can take our bone. And here we see our nerve right here, perineal nerve. So we want to make sure that we can isolate and protect it. So now that we've identified our nerve, next we're going to take off our lateral musculature. And we're going to do that by leaving a cuff of muscle on the bone. And let's make sure we open this widely. And we'll do this all the way until we see the intermuscular septum, which is this grayish silver structure here, which separates that lateral compartment from the anterior compartment. And next we're going to go ahead and open that up, which will give us access to the anterior compartment. We like to stay close to the fibula here. Separate this right off the bone. The plane of this section will then change deeply and take us right to our interosseous membrane. We've taken off now the anterior compartment. In the anterior compartment, anterior tibial vessels here. Actually, the final maneuver will be to open the interosseous membrane, which exposes the posterior compartment and the posterior tibial muscle. Again, we need to be careful superiorly. We've protected our nerve and also some of the vessels that we'll begin to see once we're on the other side of our dissection. Okay, next we're going to incise posteriorly. We see where our perforator is running directly into our flap, so we're going to incise on the other side of this now. Come out, make sure we capture that perforator. Open the fascia. Expose our gastroc and soleus. We can open up our, push away our fascia here and see where our perforator is. It's sitting right here. Begin to release some of the soleus muscle here. That's our septum. Here's our perforator. Sparing our perforator. Releasing it from the soleus muscle. The nice thing about this flap is you can certainly carry muscle with the flap. You can carry soleus as an extra muscle. So we're going to now find our flexor hallucis muscle. Flexor hallucis is going to contain our perineal vessel. As we free up the muscle from the fibula, and There's our reeler plane that we can get into to separate some of this soleus from our flap. Here's our flexor hallucis muscle, perineal vessel. We'll be running right along here, along our bone. We're going to go ahead and divide our bone now, above and below. So we have our nerve is here, and we're going to go ahead and just free up circumferentially so we can use our saw. Vessels can be very close to the bone here, so we just want to be really careful and make sure we free this up and protect it. And we do the same thing down below. Free this off of the flexor hallucis. Okay, so we want to free up the flexor hallucis here, and we can divide this. There'll be a tendinous portion as well. We want to look for the distal portion of our perineal artery. This can be used as a flow-through flap. Some of our vessel here, it's ligated. And here's our pedicle. So we see the stump. You can see why it's a large caliber. It would be useful as a flow-through flap. We want to maintain this now with our flap as we begin to elevate the flap. Soleus, we'll start to separate soleus off as we begin to get under posterior tib and divide the posterior tibialis. We'll begin to see our pedicle, which you can see very nicely right here. Here's our pedicle running within the flap. These side branches will be ligated. We begin to elevate and take the rest of this soleus off. We need to be careful about our perforator. A little cuff of muscle there to protect that. And we can elevate our flap up, dividing posterior tib. This way here. Let's look at the other side. There's that bipinnate pattern of the posterior tibialis muscle. We know where our vessels are on the other side. Protect our vessels. Take the rest of the soleus off. And we begin to see the source of our perineal vessel. And you can see why the higher the bone is taken, the easier it's going to be to get in here and dissect this pedicle. Very large vein, as we can see right here. Artery, sometimes you have to take a little bit more. You definitely want to take it right up to the tibial perineal trunk. You can see one of the large veins here, often two veins. If you need more venous length, you can take the vein higher. Here you see is a large branch to the soleus. So if you're going to take part of this soleus as your flap, you keep this branch intact. We're not carrying any soleus with our flaps. We're going to go ahead and divide that. You can see a considerably large vein. The artery and the vein are usually quite intertwined, and it'll take a little bit of dissection in front and in back on both sides to really isolate this. So we see our veins very nicely here. We need to release these little attachments. So the flap's now isolated. Here's this perineal artery, tibial perineal trunk. And here's the venous system. So the perineal vessel can only be taken at the level of the tibial-perineal trunk. Venous system can be taken much higher up if you need more length, and this can be done in the head and neck area, especially where the artery and the vein are in different, the anastomoses are in different locations. Here we see the skin paddle as well. It's perforator, still attached, one proximal, one distal. This can be used as a monitoring segment, or it can be removed if it's not required.